parents only complaining about children. So it is like we have to instill this point again and again, so that it is really important. So most common psychiatric disturbances in children are related to developmental delays in one or more domains. So this is actually developmental. Normal development includes different aspects in a child's life. So this normal development is certainly disturbed by certain things in the certain problems or deviant patterns or deviant variations in the child's development, and it creates the common psychiatric disturbances. So that is why we have to like make a point to specify to the parents to each and every development of the child is really important, starting from the neonate or starting from the birth. Developmental status influences the clinical presentation of various clinical syndromes. So if we know the normal development status only, we will be able to see what is normal, what is abnormal, what is the deviant pattern, what is the non-deviant pattern. So all these things are like really important when we know only the normal development pattern. And the third point is distressing emotions, impairing behaviors may occur as a part of normal transition. So sometimes some children, they would develop normally, but many a times due to emotions which is being like suppressed, and some behavior which is not normal. Some children, some behaviors may be normal or may not be normal many a times. But we cannot label everything as an abnormal behavior. Some might be due to a very trauma for the child, or a shock to the child, or any kind of disturbance which happens in the child. Every child who creates temper tantrums, who cries, doesn't make on its own. You have to understand it is the time for the child to connect with us. So the child wants to connect with us. That's why the child is creating temper tantrums and all sorts of emotional disturbances. We have to find out what is the problem with the child. So each and every time when a child cries, don't think that the child is doing deliberately, or the child like wants to do it. It is not actually, every time it's not actually the same. So each and every time it differs. So that is why it is very important to know what is the normal development before going into all the deviant patterns. And developmental criteria. The clinicians need to be able to distinguish the normal development. First thing, which I already told you, and individual differences from delayed or typical patterns of development of behavior. Like you will have a different sort of developmental patterns. See, it is not a structured criteria that a 1 month year baby should do all these 1, 2, 3, 4, 5. Some babies may do at 1 month, some babies may do at 3 months. So we have to, we should know how to modify it. We have to know how to like assess it perfectly. See, if a child is not going to sit up to 8 months, then definitely it is an abnormal pattern. So that kind of clear variation we have to follow. So then only we can tell the parents, or we can tell the people who are approaching us that this is not normal. And we cannot say that when a 3-month-old child is not turning down, it is not normal, because some babies may turn upside down only by the 4th month also. So we have to just wait and see. And it is not only about this delayed or typical patterns, it also behavioral patterns are also differs. So all these things are to be observed very keenly by the clinician, and it should be taken into consideration when we do an assessment. When a delay in development or behavior is identified, when a delay in development, as I said earlier, when a child cannot sit without support by 8 months, then you have to think, why is this development delay happening? And when there is a behavior is identified, like a child, a baby who is been like in 8 months or 9 months of age, creating temper tantrums, too attached to the mother, or throwing away things, it's a normal pattern. And sometimes a child may do the same thing up to 4 years also. So if the child is going to repeat the same behavior up to 4 years, then definitely you have to take into consideration like how is the behavior is being changed. So all these things are to be keenly watched. And next comes the diagnosis. So afterwards, the diagnosis comes and then the management. So after diagnosis, the management comes and then the counseling of family and coordinates care. Of course, the counseling of family is really needed because you have to create assurance, you have to instill confidence in the parents that whatever you're telling, because it is a very sensitive issue. So you need to counsel the family and even the parents, so that it is very important in your career. Devi Priya, is anything shown on the screen? Like, please move this window away from the shared.
Yes, ma'am. Yes, ma'am.
Oh, it is showing on and off. Huh?
Yes, ma'am.
Just a second. Sorry for the inconvenience. I'll just do it again. Is it now showing? No.
Now it was clear, ma'am. It is clear, ma'am.
Okay. So I think this point everybody understands why development criteria is really important. And even I don't know how is the crowd, like if there are practitioners or if you are having children at home, definitely you have to take everything into consideration, because when you practice with your children, it is very easy to observe with the kids who are coming for your in your clinic. And the next one is it's clear, Mama. Devi Priya, it's clear, no?
Yes, ma'am. It is clear now, ma'am.
Okay. And next is the fundamentals of development. So what are the fundamentals? What are the basics thing needed in the development? Major developmental milestones, methods of assessment, signs of developmental variation, approach to development delay or deviant patterns. So as I said earlier, everybody may know the milestones which we read in our text, and we see usually in babies up to 1 year, 2 years, 3 years, 4 years. Methods of assessments. There are lots of methods of assessments, but every method cannot be done by us. Some methods, there are some limitations. Some easy methods are there which you can make a simple assessment test at your clinic, and then you can proceed with the diagnosis. Some assessments, definitely you have to take the help of the clinical psychologist, which is utmost necessary in many cases, like ADHD and autism, because both mimic each other. Like autism and ADHD, many a times it looks the same. We have to assess easily, we have to assess with certain scales, so that we can come into a conclusion that what is needed for the child at that point. So that is why methods of assessment are really necessary. But as a Ayurvedic doctor, I am practicing some easy methods of assessment in my clinic, which I will share with you all in the upcoming classes. And signs of developmental variation. So there is variation, as I told you. One child might develop the developmental milestone will be a little bit earlier, some may have a bit later. So these are all some signs of developmental variation we have to keenly observe from the beginning. And next is the approach to developmental delay or deviant pattern. So what is the approach? What are we going to do if there is a developmental delay or which is a different one? So all these things are to be taken into account, and we can decide our treatment. Of course, you people all know that in our system of medicine, we have various effective medicines and even various effective practices to enhance the health and to promote the disease-free life. So we can, as a collaborative approach, as an integrative approach, if we do, definitely we will succeed in this field of medicine. Next comes the domains of the normal development. I have been speaking from starting that domains. So what are all those domains? So domains are like everybody at a final point, we derive that every child should get developed and every child should study well. Every child should be academically well. So that is the major thought of every parent or everybody who thinks about a child. Okay, so what are the domains? If we speak about the domains, the first thing is motor skill development. So motor skill development includes both gross motor skills and fine motor skills. And next comes the aesthetics and creative expression, that is the emotional regulation. And next comes the numeracy. Numeracy is about counting numbers and stuff. And next comes the language, that is how the child speaks and how the child reads. And next comes the discovery of the world, like how it is socially how it is like exploring the world, how it is seeing all these things. And next comes the social and the emotional development. So these are all the domains of normal development, and we would see in today's class, we would see the different areas of development in a brief view. So I would be discussing, these are all some key points which I will be discussing. The age of acquisition varies in wide, because the age of acquisition in the sense at a particular time a milestone may be achieved, but sometimes it would diminish within a few days or even few months. So you have to keenly observe what is going on. And then the domains of development are interdependent. So they are not dependent on each, like you cannot, some children will not crawl, they will walk directly. So that crawling milestone is not there. So it depends upon each and every baby. So these are not, they are not like always dependent on each other. They are interdependent also. And next, cognitive abilities in infancy cannot readily be distinguished from sensory motor function. See, sensory motor functioning and cognitive ability in infancy. In infants, you cannot easily diagnose the cognitive abilities. When we will speak about this cognitive development, you will better understand this. And then this sensory motor functioning. This sensory motor functioning is also different in an infant. So when you see an infant, if there is no eye contact, don't decide that the infant has autism. You cannot come to a conclusion like that. Okay, you have to wait, watch and see, and then only you can like do some assessments, and then only you can come to a conclusion that the child is having the baby is having autism or the baby is having ADHD. No, there is no assessment for a newborn. There's no assessment by 1 year, 8 months and all. You cannot assess a child. It is very difficult. But for some children, there are some typical features where you could assess that this child is autistic, because before labeling anybody, you have to be really confident on yourself, and you have to be like, you cannot be judgmental, right? So even autism is a stage of life where that child is in a different zone. We are in a different zone. So you cannot label anybody like that. So to understand well, I think when we see about this cognitive development and sensory motor functioning, this point would be really clear to you. And next, early reflex patterns, congenital, sensory and motor capabilities are the building blocks of higher order skills. You know, higher order skills are really important for our social life existence. So this early reflex patterns, there are some major early reflex patterns which I will be discussing in the upcoming slide, and they are actually missing in some congenital anomalies. And sensory and motor capabilities are in fact the building blocks of the higher order skills. So sensory capability, motor capability, both are really important. So these points I would be discussing. So as you all know, gross motor development, gross motor skills includes large movement of muscles, legs, arms, as they might, if there is muscle wasting or if there is hypertonia, hypotonia, all these things as physicians, I know you all can diagnose it better. For example, there is coordination to walk, balance, run, jump, climb, throw, as I told you, crawling, holding up and walking. All these things are noticed in a child, in a baby, where I think this area is more clear about this area is very much clear to all the people here. So this can be easily identified. And next, this is actually the reflexes which I have been speaking, right? I told you that there are some early reflexes which you should actually follow. You have to ask the parents when they come, like when did the child hold the head up, when did it start rolled over. Many parents actually now they are just capturing the milestones and keeping it as a photo, so they remember even the date, photograph, everything they have. So I think in some generations before and all, nobody would remember what is happening with each and every baby. Now the babies are the center of attraction, so that the parents are more like they have more attention on the babies. So this Moro reflex is from 3 to 4 months, and hand reflex is from 4 to 5 months, rolling over both ways. And 5 to 7 months is rising up on hands, like the baby keeps its hand as support and it rises up with only the chin up. And next 6 to 8 months, it starts crawling. And by 6 to 8 months, it even sits without support. Sometimes when a baby is not allowed to explore more, this sitting pattern will be missing. And sometimes this crawling pattern will also be missing, because most of the babies are put into walkers. And some parents who don't have time, they don't lead their children down. When the child like crawls more and it explores more on the ground, then both the fine motor skills also develop and the gross motor skills also develop easily. And then 9 to 10, usually the child, the baby stands with support, and from 11 to 15 months, the baby starts walking with holding with support, and many babies even walk without support. So these are some of the reflexes which should be one second, which should be like noticed when the child grows. Next is the development of locomotion. So this development of locomotion is, as I told earlier, the earlier slide was this reflexes, and next comes the development of locomotion. In this development of locomotion, it also speaks on the same thing, like the fetal posture is like this, and 1 month the chin is up, 2 months the chest is up, 3 months the reach and miss, like the child, when you keep a chime on the top, the child tries to reach and misses, and 4 months it sits with support, 5 months it sits on the lap and grasp objects, 6 months it sits on high chair, grasp tangling objects, 7 months it sits alone, and 8 months it stands with help, 9 months stands holding furniture, 10 months it creeps, 11 months walks when led, 12 months it pulls to stand by furniture, 13 months climbs stair steps, 14 months it stands alone, and 15 months it walks alone. So these are some of the development of locomotion where it gives a better understanding. I think you can have it as a chart in your clinic, so that when or else you can just memorize it, so that you can ask the parents whenever they come, is the baby doing all these activities? Is the baby is trying to do it? Or else you can you can ask the parents to keep a keen watch out to notice all these things. And the next slide is about the fine motor development. Fine motor development is fine motor skills which are done with all the very intrinsic activities with the hands. So it relates to the use of the upper extremities to engage and manipulate the environment. So it is useful to the upper extremities to engage and manipulate the environment, in the sense it is actually very important skill. Not only we feel that it is only fine motor development, it doesn't have a very big effort in the later ages. But actually, when you see, this is a very important skill for the child to hold a pencil, to color, to write. And most of the parents complain that the child is not holding properly, the child is not writing properly. The handwriting is not legible. And sometimes, many a times, there are learning difficulties also when the parents say, usually to the Ayurvedic doctors, they will ask, my child is not having very good memory. Can you just give any syrup or lithium to promote promoting memory in the children? And we also say that yes, we can give Saraswatarishtam, we can give Saraswataghritam or any other specific medicine to promote. But before that, please make a note that whether the child is developed fine motor development. Without, yeah, definitely our medicine is going to help, but we can be more practical and more scientific and more clinical in doing all these like small things which we can follow. So this fine motor development is really an important point which should be noted in small children, in babies, and awareness should be given for the parents also. And this involves smaller muscle groups such as those of the hands and the wrist. Basically, hands and the wrist, the muscles are involved. And this is the first grasp or the involuntary grasp, a newborn grasp. Newborn grasps reliably and reflexively at any object placed in the palm and cannot release the grasp. So when you like give the finger like as it is shown here, when you give the, many would have been experienced this. So when you give your finger, the child would not release your finger. The baby would not release your finger because it is a grasp and it is a fine motor development in the newborn. Any object, not only your finger, any object, the baby would not release it. And from 2 to 3 months, the child would do thumb sucking because it actually, this is a self-soothing mechanism. As a child is growing up, as a baby is growing up after coming out from the mother's womb, it is growing up in an environment where it is getting accustomed to. So after, for getting accustomed, it has some self-soothing maneuvers. So this is one of the self-soothing maneuvers where the child starts to thumb suck. So it becomes a habit. Some babies do it regularly even when they grow up because due to loneliness, due to even some children when they grow up to 5 years also they thumb suck because they feel they have some kind of fear which is not expressible. So these things have to be taken into account. Like some babies, they just do thumb sucking for some time and they leave out. So these are all some of the points which should be noted. And up to 4 to 5 months, the baby gazes at an object. It just sees an object so that it is having. It will gaze at an object and it will also try to reach to a point. And 5 to 7 months, when the baby starts sitting, it actually will reach the object many a times. And by 9 to 10 months, the baby starts to identify the faces. Even before that, nowadays the baby starts to identify the faces by 4 to 5 months itself. 9 to 10 months, seriously, the baby will actually identify its own face. It looks into the mirror a lot, and it will actually have this. It will see the mirror and it will speak a lot. And by 9 to 12 months, this is one of the most important habit which should be followed in the babies, and we should as clinicians or as doctors and even as parents, when we deliver a baby and all, we have to encourage children to do self-feeding. Self-feeding is one of the major mechanism which improves fine motor development. If you take a history of any child having emotional behavioral problems, definitely this would have been missing. Because most of the time, the self-feeding is not happening, but nowadays I think there is a whole lot of awareness. I think there is a big group called baby-led weaning group. So that group is actually a group of psychologists and some non-medical people running the group, where they encourage mothers to self-feed the babies from 6 months. So they will actually make the baby sit like this in a chair, and they will keep all the food items on this table so that the child will eat even carrot, even whatever vegetables they want to give, whatever things the child will eat on its own. Even a 6-month-old, 7-month-old are trained to take the food on its own. So this is one of the major important activity where you have to give awareness as doctors to the parents when they come if they are not started these. So this is the important mechanism where you have to keep in your mind that the self-feeding, when it is not done in a proper age, then definitely after growing up, see, mess would be there. All the parents would say that I cannot leave my child to eat on its own because she or he makes a mess. It spills all over. Yeah, definitely. Children make mess. Babies make mess because mess is one of the self-soothing mechanism for the babies. If they make a mess, it actually soothes their mind. It will. You just try. You can try and see when you see a baby who is doing everything spills over, plays with mud, draws on the wall, everything. When everything is done, the baby will get tired and it will sit or it will sleep. But when you restrict that, don't do this, don't make a mess. Every time you don't want to make a mess. See, here this baby is feeding and it is a mess actually. So the thing is, you have to allow the child to make the mess, and then automatically the child will have self-soothing mechanism, and definitely after a certain age, it is not going to make. So it is a self-soothing mechanism, and this feeding habit also, it is a mess, and you can inculcate even table manners in the table etiquettes in the children when the self-feeding is done prior. And by 1 year of age, the child has become more independent, and it plays and it walks independently, can do everything independently. So these are some of the fine motor skills. And next comes the complex fine motor skills. So this what does this complex fine motor skills? Like, it has a lot of coordination and lot of balance in these activities. Like when a ball is thrown, it usually develops in 2 years. When a ball is thrown, and sometimes the child will throw back, and sometimes stacking up of towers, blocks, books, and holding a cube with the hand, and the kind of hold the child is going to have, or the grasp. I will be speaking the grasp. The next slide will be about grasp, and even the grasp, how the child is going to hold an object. It also matters. And see, there is an example which I have given as cup and spoon. Uses cup and spoon but spills all overall. In the 12 months, the child will not be able to balance. So the child will actual coordination and balance will be missing. So it will spill all over. And 15 months cup without spilling. He or she can eat with a cup without spilling, and spoon without spilling. He or she can eat with a cup without spilling, and with the spoon, which is more intricate and it needs a lot of attention. By 18 months, definitely a normal child would be able to do the spoon without spilling. So all these things comes only with practice. See, you're not going to give the child to explore anything, and how would you expect your child in 18 months to do a spoon without spilling? It is not possible. So first you have to tell the parents, whomever like asks you doubt, or whenever you see a child, you definitely ask like how is he eating, or you can just demonstrate by having some blocks or cubes in your clinic, or just fitting into each and every cube in different shapes. All these things can be done easily. And next comes the evaluation. Like, how do you evaluate your fine motor skills? As I told earlier, it can be done by physical examination. If there is any problem with the vision also, the child will not be able to do many things. So vision test can also be done. Many times there is lack of concentration in these studies when the fine motor skills is lacking. And neurodevelopment assessment. Many times when there is a problem in the neurological system, definitely there is a neurodevelopment assessment is needed. And I told you that I would be discussing about the grasp. So these grasps are really important. See, 6 months, there is a grasp called rake grasp. Like the thumb is abducted like this, the thumb is abducted like this, and the joints will be flexed. And many times if you notice a 6 months old, it would keep the hands always like this when it tries to reach for an object, or when it holds an object, when a baby. And 7 months, it would be like inferior scissors grasp, like raking object into palm with flexed fingers, and proximal and distal thumb joints will be flexed. It will be like this. It will hold like this always. Sometimes when sleeping also, many times the children will close their fists and close their fist and sleep. And 8 months, it would be like scissors grasp. Scissors grasp is between thumb and side of curled index finger, distal thumb joint slightly flexed, proximal thumb joint extended. So this is a kind of grasp where the object would be hold here. And 9 months is the inferior pincer grasp. Why are these grasps important? Because all these grasps definitely has a later effect on writing, because whatever skills we are going to do with our hands, the major point for a child during education is writing and drawing. All these skills comes from these grasps. So to improve these grasps, or these grasps are normal in the normal development, but to enhance it, we have to do certain activities in the daily life, and we have to allow the child to explore. So this inferior pincer grasp is between ventral surface of the thumb and index finger, proximal and distal joints extended beginning opposition. So it would be like this, somewhat like this. And 10 months, it is pincer grasp. Pincer grasp is exactly how we hold a pencil. How we hold a pencil or a crayon, or it's a pencil grasp. Between distal pads of the thumb and the index finger, proximal thumb joint extended, distal thumb joint slightly fixed, thumb opposed to index finger. So it would be like how do we like in 10 months itself? Mostly nowadays, when I see the babies, even in 11 months, they are able to hold a pencil. They are able to hold a pen, and sometimes they will hold like this and write. If you watch babies and all. That is also normal. When they first start to do like this, then they will keep some 2-3 fingers, and then these two pincer grasp will develop. 12 months, fine pincer grasp between fingertips or fingernails, distal thumb joint flexed, proximal thumb joint slightly flexed. So this is the exact point where we will hold the pencil. So this fine pincer grasp develops in the 12 months. And this is actually for the older children, fine motor evaluation in older children. So this fine motor evaluation in older children, it can be elicited by a very simple test, which I follow in my clinic all time. Because whenever a child comes, when it is not able to express itself, I would ask the child to draw a diagram or draw a picture, or I will ask how you would like elicit what it is, how you would like express your feeling, and I would ask some questions like, what are the 3 wishes you wish? If God comes before you, what would be your 3 wishes? So when a child comes like more depressed, or she's not opening up, mostly 7 years, 8 years children and all, they will not answer your questions, like they will not sit properly and they will answer. So at that time, you can just give some activities for them to be fun. And even with that activity, you can understand a whole lot of things. When a child comes and when you ask for her 3 wishes, if she is happy, she will draw a flower with a garden or a place where she can go. But a child with lots of problems or some trauma in her mind, she will actually depict the same thing. And sometimes, many a times I have seen children saying that I don't want my mother and father to be fighting. I don't want to read maths. Many children tell that, because they feel that maths is so tough, because every time they have put some academical pressure on them. So they feel it is a very tough subject. Because I'm always told that I'm weak in maths. Every time when you tell a child that, yeah, you're weak in maths, you're weak in maths, you're weak in maths, definitely the child is going to have the same affirmation in its mind. So these are all some of the tests which you can do. So how to do this test? It is actually like, you can ask the child to draw a person. It can be an animal or a human, but basically if it is a human, it is good. and with that you can ask him or her to draw it. So it includes, there are some points, there are some scoring points. See, this is a diagram of a 4-year-old. So it includes a head. So legs might be 2, arms 2, trunk, and length of the trunk is greater than the breadth. Like the length would be greater than the breadth, and arms and legs attached to the trunk. Like how it is drawn, it is drawn proportionally or it is drawn irrelevantly, and legs and arms attached to the trunk at correct point. Neck, eyes, nose, mouth, hair, and ears. So all these things are taken into account. And there is a score of 13 points. So the mental age, so 3 plus 13 divided by 4 is equal to 6.25 years. So this calculation, if the child is around 4 years or 5 years of age and the child is getting this calculation, definitely it is a normal development. So it is not necessary that you should actually calculate like this. This test is known as good enough test. Just you can just watch like how is the diagram. Like it is like a normal thing, or if there is any abnormality, you can ask the child why you have drawn like this. Or sometimes don't pester the child and ask again and again. Just it is a normal thing to ask, like why you have drawn the stomach to be too big. Why it is not a normal thing. See, my stomach is like this, your stomach is like this. Why you should draw it too big? Then the child will have an answer that no, there is some other reason, or she might have seen from a cartoon, or she might have seen someone like this. So that is why she would have drawn. And some may draw only one hand. If you ask why there is no other, where is the other hand? The child will say no, the other hand is got cut. If you ask why, how it is got cut, and she will tell a different story. So it is all like some things where you have to keep in mind how to go about it. And why there is the need for evaluation? Why you have to evaluate? So first thing is the neurodevelopmental assessment. So it is single-handedness. Like for example, I was telling all these times that there is some neurodevelopmental problem, means how you could identify it. The first thing is the child will be using only a single hand for all the activities. That activities, it might have some neurodevelopmental assessment over a period of time. See, many people might think why a doctor is always telling that you have to wait and watch. See, nothing cannot be assessed in a certain point of time. As I told, in 3 months of infancy, there is no cognitive, you cannot assess the child baby cognitively. So you have to wait and watch and then only see. So many a times the child which uses only a single hand or a single limb is also used in many times. So in those cases, neurodevelopmental assessment is really important. And in 18 months of age, non-developed use of thumb and pincer grasp. If the thumb and pincer grasp is not even developed until 18 months of age, then definitely there is some developmental issues. So that should be assessed. Greater impact on legible handwriting, task completion in spite of sound academic and conceptual skill. As I told earlier, these fine motor skills are really important for a legible handwriting, task completion. Task completion, how it, you can ask me like how task completion and this fine motor skills are like interconnected. Fine motor skills are the higher order centers in the brain, which activates the higher order centers in the brain. So when you are doing a task completion, it needs a planning, and then task completion occurs and decision making is also there. So all these characters are going to develop when you are developing your fine motor skills. So you all please understand like how important is this fine motor skills in a child's development. And these are some of the self-care activities for the patient's awareness. Like you can ask the parents to encourage these kind of activity like self-feeding, as I told earlier, and you can like ask give an activity for cutting, but with care. Because in Montessori education, most of these activities are followed, like cutting, ironing, like making a dough, or this play-dohs are there, which you can squeeze it with your hands. It gives more strength to all these small muscles. And beading, you can just give some beads And you can ask the child to do a bead with her hand with colorful beads. All these things can be done. And buttoning is one of the important development where you have to inculcate in children. It is done properly by 3 years of age. It is done properly. So this buttoning can be done like nowadays. You can have for this fine motor development, even speech delay. For speech delay children also, this buttoning, this self-feeding, this beading activities and all develop speech so easily, because most of the time, even I had a child like she was 3.5 years old, but she could not even utter a word. She will utter a word, but nobody can understand. The child did not have any problem. They came to me first, and then I sent them for a clinical psychologist assessment. And the psychologist didn't find anything abnormal, but she put a question mark for ADHD and also for autism. But for me as a child, for me, she was normal. Then what I did was I took a brief history from her, from her birth till 3.5 years. So the major point which I noted was she was exposed to screen a lot. She was doing, her mother was giving her the mobile for everything, for even for drinking milk. She would drink milk like this, and she would show the screen like this. So she was exposed to this all cartoon activities, and without screen, the child was not allowed to explore anything. So the child didn't know that there are these activities and stuff. So the child developed speech delay, and they were like worrying, the parents and even the in-laws and everybody were worrying that this child is having some problem. Why is the child not talking? Why is she was expressive. She could express whatever she wants, she would express. But she was not able to utter words, which is not clear. And then what I did is I didn't give her any medicine. I didn't like give her anything. I just actually made her to explore herself first. First, I told her mom that you just don't control her anything. Just you have to just reduce the screen activity, which is very tough at this point. So you have to spend a lot of time with the kid. And even she would come to me at least weekly, thrice 1 hour. She would come to me, and I would give her all these kinds of activities like beading, and I would ask her to play with the mud. I would ask her to buttoning was not able to, she was not able to do in the starting, but when after 1.5 months or so, she started to speak very well, and now she's singing all Tamil songs, English songs, everything. Now she's like around 4.5 years old. So every time she would, whenever she's having any pain in her, any part of the body, she would definitely take a WhatsApp and she will do me a video call and ask me like, doctor, I'm having Hema doctor, I'm having this pain. You just tell me the medicine. I want to, you are my doctor, so you have to tell me the cure. She's become so intelligent and so brilliant that the child did not have any problem, but only the screen exposure was there. So like this, many children are there. So if you assess them properly and give them proper training, definitely they will overcome this problem. And even if you go to OT, clinical psychology, definitely they will like say, see, this is the problem. And they will also be they all depend on all the clinical assessments. So as Ayurveda doctors, if we practice this in our clinic and if we approach the children in this way, I think we can give a better awareness to the parents, and even we can do better than them. And next is the cognitive development. So I was just speaking about cognitive development. So cognitive development is everything. Like it includes all the lobes of the brain, and it includes everything. Like everything, in the sense like endless repetition stem, the good night, the wheels on the bus. So acceptable, what are all is acceptable, whatever the kiss you give the children, whatever the hygiene avoidance. These are all things which a child avoids, like the hygiene, toothbrush, nail clippers, Kleenex, all these things, and the phone call. So it is the interruption ganglia. Like when the child is not given attention, the child definitely feels bad. So these are all some of the areas of the brain which each and every emotions are being recorded. So Piaget is a psychologist who has given the stages of cognitive development as sensory motor stage. This occurs from birth to 2 years. And next comes the pre-operational stage. Pre-operational stage is from 2 to 7 years. And next is the concrete operational stage. So sensory motor stage is just the child feels everything. It explores everything, starts to explore. So exploration starts from even the birth. So it explores. Pre-operational is the child will be able to say which is what. The child will be able to say the milk is white in color, or the goat is black in color. Like that, the child would be able to say what is what. And that child would also like to feel everything. And even many children, they would say which is hot, which is cold and all. And concrete operation stage is like more or less, empty, full. All these things develop from concrete operational stage and formal operational stage also. So formal operational stage is like they can actually clarify which is greater, which is lower. So all the math skills and everything, it gets developed from the pre-operational stage itself. And of course, it is becoming more and more in the coming ages. So that is what the Piaget stage or stages of cognitive development states. Next is the sensory motor intelligence. So sensory motor intelligence includes primary circular reactions. That is the primary reactions which occurs in birth. Like every time the child would be like crying and it would seek the mother's warmth, and the child would smile to the mother. And all these things happens in the stage 1. And stage 2 like is 1 to 4 months, the smile, the social smile occurs. And from stage 3 is the secondary circular reactions. Apart from these like gazing and smiling, the child has other reactions like exploration starts. And by the stage 4, the child will be astonished by many things, like it will see the spinning top or a doll, and it will show, the baby will show her own reactions. And tertiary circular reactions is many a times the child shows anger and the emotions are more prescribed. And the stage 6, it will be more like mirroring the parents, like it would do all the activities where the father and mother does. So this is the sensory motor intelligence. It includes both the sensory skills and the motor skills. And this is the most important thing, the symbolic play. This symbolic play is, you can ask the parents whether they do all these kinds, because these are all some important things in cognitive development. So what are the reasons for the child to engage in symbolic play and how to make it happen? So these are all the reasons. Symbolic play develops physical development, problem solving, language development, emotional development, creativity, social skills, early literacy, and numeracy. So for all these reasons, I think symbolic play is utmost needed, and to encourage it in the children. So how it is played? Make use of items around you. So you can ask the parents to make use of the items around them, unconventional way. Like they have, everybody has their own way. Every child has their own way. So the play would be like more creative for each and every child. Usually every child has its own type of playing. And imaginative substitutions, like a cardboard box on the head, and playing like making fear out of it, and see like a rocket, like a princess. So each and every child has his or her own imaginations. So you should not tease the child when the child is playing like this, and don't laugh in front of the child, so that you have to be with the child, and you can also play along with his or her play, and you can be a part of it. So the child would be like more confident with you and feel free with you. And next is the logical thinking. So logical thinking, how the thinking happens means. So it is the ability that begins to emerge around 7, in which children use mental processes to solve problems rather than relying solely on perceived information. Like children, see, when you say the fire is hot, they will accept that it is hot, but some children, they will have the habit to just touch it and they get hurt and they feel, oh my god, the fire hurt me. So it is like many times like jumping from one place to other place. The child will say that I may jump this. He or she will come to a conclusion, and sometimes it will fall down, and then she will understand that, oh, this is not my genre. I have to be more careful. So for that, without falling, how can I do? So these are all some, this is what is called as logical thinking. And how is a cognitive assessment usually run? So cognitive assessment for children usually includes gathering comprehensive background information through interviews with the child, parents, and school teachers, the administration of standardized tests by trained psychologists, a feedback session, a provision of a report to explain findings, provide recommendations and opportunities to clarify information. So these, for every assessment, everything is needed, but for the cognitive assessments, definitely we have some standardized tests, and we can also have a brief report. And tomorrow, I think we can, I'm just going to take about history taking, which is really important in assessing a child and adolescent. So these are all some types of scales which I have mentioned, which is used commonly. This is all for your information. Because these scales are all available online, and you have to purchase it, and then you have to know how to use it, and then only you can make the calculation. So standard intelligence scales are standard Binet intelligence scales for, it is used for from 2 years to adult, and Wechsler intelligence scale for children 4. This is used from 6 to 16 years. Non-verbal intelligence scale is for lighter international performance scale, which is used from 2 to 18 years. Infant development test. I was telling you about some infant scales, you know, Bailey scales of infant development 0 to 3.5 years, and Jessel developmental schedules. Developmental scale for the visually impaired. Even for visually impaired, there are some developmental stages. Reynolds-Zinken developmental scales for young children with visual impairments. It is usually done from 0 to 5 years. Adaptive behavior, Vineland adaptive behavioral scales 2 from 0 to 18 years. Adaptive behavior assessment system 2, 0 to 21 years. So these are all some scales which you cannot, which is really important to know, because many a times when we get a report from the clinical psychologist, they would mention all these scales, and we have to understand like what is what. So that is why we have to have a brief idea on all these things. And see, I have just given a gist like what are all the baby's milestones from 1 to 3 months, like being able to lift and control their head, starts smile and laugh, responds to familiar sounds, makes eye contact, and 4 to 6 months is maybe able to roll over, maybe able to sit up. Teething is likely to begin. First solid foods, may be able to grab objects. And from 7 to 9 months, the baby begins to crawl, may be able to stand up, hand and finger skills develop, may babble from time to time, sees in full color. And from 10 to 12 months, may begin to talk and say their first words, may be able to understand words, recognizes and points objects, looks and listens at the same time. So from 13 to 18 months, takes their first steps, uses a cup, may be able to scribble, plays with books, plays simple pretend. Like many a time role plays they do. Role plays are really interesting. Like they see their mother working in the kitchen always, so the children all takes the cups, spoons from the kitchen, and she starts saying that I am making dosa, or I am making an omelette, or I am giving you tea, coffee, and they do all these role play with the kitchen set and stuff, and it is very interesting for them to do. And even many children do role play as a father also. So all these activities are to be encouraged, definitely. And next comes the language development for the preschoolers. So language development is also one of the major important point in the domains of development. So language development occurs even earlier, and before that for the preschoolers, that is from the 2 to 3 years. Phrases of 2-3 words turn into 4-5 word sentences. Child will ask questions why, what, and where. Will mispronounce many sounds at this age. So from 2 to 3 years, the child will have a kind of, as we say in Tamil, Malalai. Kurandai Maralai, it is like both interconnected. The earlier words of the child look so sweet for the people to hear. So that is like the child will mispronounce, and many times without teasing them, we have to tell them in a very friendly manner to pronounce the words in the proper way. Then they are starting to pronounce like that, because it is really important. When they grow up also, sometimes they pronounce the same way. As I told, they will keep some many words are like that. So you have to encourage the child to do the proper pronunciation from the starting itself, so that the child will have a legible speech, and the tongue, you can also practice some tongue exercises. You have to do some tongue exercises like doing like this, and twisting the tongue on and off. All these things will develop a better speech pattern. And even for speech in our Ayurveda, we have many wonderful drugs which works wonder, which we have in our Shishu Paricharya also, which should be followed. It can also be specifically said for the parents. And next is 36 to 48 months, that is from 3 to 4 years, uses increasingly complex sentences, can recount stories and events that happened from the recent past, can be the year for the occurrence of non-fluency or disfluency. So sometimes if the child is not, that is why I am telling you from 2 to 3 years itself, when there is a mispronunciation, you have to correct the child, which in practice, sometimes the child may develop to pronounce normally. But sometimes for some children, there will be a tongue tie. Tongue tie is the tongue would be like attached to the frenulum. So at that time, the child will not be able to pronounce certain syllables, certain sounds properly. Even now when we see some people, they will talk like this. So some sounds will not be pronounced easily. So for that, you have, whether the child is having a tongue tie or not, how we can know? You have to see when the during this 36 to 48 months itself, when you start practicing from 2 to 3 years, in 3 to 4 years, definitely you can see whether there is a tongue tie or any other problem with the child. What is the reason for the non-fluency and disfluency? Okay, there is a difference between non-fluency and disfluency. Disfluency is the difficulty in certain sounds, and non-fluency is the child cannot speak fluently at all. So all these things should be taken into account. So the history taking is really important to know the different factors which I have been discussed today. And 4 to 5 years, his vocabulary exceeds well over 2,000 words, tells long stories and talks about their feelings. Sentences are grammatically correct 90% of the time, is generally easy to understand by others. However, child may still make a few errors in speech sounds. So these are all some of the language development for the preschoolers. I hope, can I stop here, or you want me to continue tomorrow? Let's have a question answer session, if at all, if there are any question and answers.
Yes, ma'am. We can.
Hello, Devi Priya.
We can continue tomorrow. Yes, ma'am.
You want me to stop here and continue tomorrow? If there are any questions, I can answer to it. So it is already 7:05.
Participants, if you have any questions, the session is open for one-to-one discussion.
If you all want a break, kindly type in the chat box, or if you all want me to continue, kindly type that in the chat box, so that it will be easier for me whether I have to stop or I need to continue. Kindly, participants, I think you can post your views. You can type in your chat box and tell me. Okay, I got a message from one person. We'll continue tomorrow. Okay, what about the others? 16 participants are there. So only one, so I can stop it. Just at least 8 persons can tell me, no, whether to continue or not. Okay, was it very informative? Were you be able to connect? Okay, that doctor, I'll just discuss it in the upcoming classes, because without knowing the basic things of ADHD and autism, definitely it is really confusing. Even I was having the same doubt when I was reading my psychology and psychiatric classes. So definitely I'm going to discuss it briefly in the third day of the class. Even in my mind, the same question is there. Okay, and you all want me to continue, or I'll stop? Just give me a positive reply. Okay, it was informative, but just give me a positive reply if you want to. If I want to continue it, or tomorrow we can continue the rest and we can start about history taking. Can continue. Okay, Roshni can continue. Okay. Okay. Okay, thank you. Thank you for your response. I hope everybody could connect with it. I was bluffing, or it was okay. You had some information. Yeah, it was informative. Okay, thank you. Thank you guys for responding. Okay, Devi Priya, can I continue, or what do you say, ma'am?
Ma'am, actually 1 to 1.5 hour time they have given, ma'am.
Okay, ma'am. Then
It's
I'll
1 hour
continue.
over, ma'am.
I'll continue.
Yes, ma'am.
So this is about the preschoolers, language development. And these are all some words which they speak from 1 month alerts to sound, 3 month it coos, like musical vowel sounds. It has A, E, I, O, U, it will have its own sounds. In 4 months, the baby starts laughing loudly. And 6 months, it will speak all the monosyllables like ba, dha, pa sounds and all. 9 months, it will speak the bisyllables like mama, baba, dada sound. 12 months, like 1 to 2 words with meaning. 18 months, 8 to 10 words vocabulary. 2 years, 2 to 3 word sentences, uses pronouns I, me, you. It will even say, I have seen a child, like she will every time say, Nila wants to do this. Her name is Nila. So she will say, Nila wants to speak. Nila wants food. Nila wants milk. Like she will say her name on her own. She will not say enak. She will not say me, I want. She will say Nila. Nila likes this. So I've seen a child like that. So it would sound really interesting when she speaks like that. And 3 years, the child will ask many questions. Even from 2 years, they are asking like, what is it? What are you speaking? Whom are you speaking to? What are they saying? Many children ask this question from even from 1.5 years, because most of the parents are with phone. So they know what is WhatsApp. They know what is a video call. I know a child from 2 years, she will take the phone and she'll see my display picture and she will do a video call, and whenever she wants, she will do, and she will talk to me. She will talk in her own way, but she wants to see me now and then. She's my patient, so the child will do like that, and I am like many a times, if I miss the call, she'll be calling me again and again. So these are all some very good moments which I enjoy. I am also sharing with you all people. And by 3 years, the child asks question, as I told you, and 4 years it says songs, poem, and even by 2 years also, 18 months also, the child sings all the cinema songs, whatever songs they sing. And 5 years it asks meaning for the words, like what is this and what is the meaning. So these are all some of the important basic things which you could know as a language development. So many students would be future mother also. So you have to keep everything in this mind, so that when you deliver a baby, definitely you can see all these things in your baby. And of course, first you all should not become panic, like when a baby is there and when 1 month is over, oh my God, all these milestones are not completed, so my baby is not normal. I have seen a parent asking me like that. Like she will, there is an app called the baby's milestone app. So every time, first 2 times she met me first time, The baby was around 3 months old. So she was saying, doctor, my baby didn't full-fledged all the 7 activities here, all the 7 milestones. I have a doubt whether my baby is autistic. I told, oh my God, why do you label your child like this? This is not fair. It is your child, right? So why do you want your child to do everything in this 3 months? Why can't it be 4 months? If it is going to be more than 5 months, then definitely I will say we have to do an assessment. But please kindly wait. Don't have so much pressure in your mind, because the mother is feeding the baby. Automatically, all the negative impressions will be there for the baby. So please don't have that kind of impression. So all these things are to be taken care. As a doctor, as a clinician, you have to tell all these things to the parents. And next is the social development. Social development is how the child is going to behave, how the child is going to be active with the social environment, with the friends. Some children will have the habit of beating the other children, because what is it, if you take a brief history, the mother or anybody in the house would beat the child on and off for very simple things. So what the child will do, it will come in the school and it will beat his or her friends. Many a times the child will not be comfortable. For that reason also the child will beat. So you cannot label a child who is beating others to be aggressive, or an abnormal child, or a child with having any problem with the neurodevelopment. So it is not like that. So first you have to be clear what you are going to like give the assessment. Okay, what is a social development in an infant? So from birth to 3 months old, making faces and recognizing. So we usually make some faces and the baby actually recognizes us. When we do that same face gesture, the baby will recognize us. Others are recognizing others. Then smiling, the baby will smile. Kicking and playing, it will kick the pillow, or it will kick the child which is above the cradle, and it will play. We have called a baby gym also, where all these things will be from the top and the baby will try to kick it. And from 4 to 7 months old, vocalizing their needs. So whenever the child is hungry, the baby will cry. Whenever the baby pees or whenever it passes motion, definitely the baby will cry. Talking to their reflection. It starts, as I told earlier, it will talk to their reflection and imitating your moods. So when you cry, the baby will also try to cry. When you laugh, it is like more like mirroring. And from 8 to 12 months old, separation anxiety. Like when the mother is not there, definitely the child will search, the baby will search for the mother, because the mother is the only person who is always remaining with the child. If it is going to be a grandparent, definitely the baby will look for the grandparent. Mimicking your behaviors. Definitely it will mimic, like when you have a handbag and walk, even the baby will have a handbag and it will walk, or it will pretend to have something as a handbag and it will start walking. And recognizing themselves, they'll see in the mirror and say, see, this is me, or this is, it will say its own name. Next, at 12 months old, interacting with others and interacting with you. Like it will interact with the mother or the caretaker who is next to him or her, and it will also try to interact with others. So these are some of the social developmental skills, which in a neurodevelopmental problem, these skills are lacking. So you have to make a point that these skills, when it is not present in a 12 months old, when it is not trying to interact, sometimes when the baby sees a new person, definitely it is not going to interact. Some babies are more socially accommodable because they will see many people daily. Some babies who are living in a very close-knitted family, that is mother, father, and the baby, it will be seeing only those two faces. So in that case, definitely the baby would be in a kind of fear or a shock or a shock when it is suddenly exposed to a outer environment. So at that time, the child will have some time to accustom. So you cannot decide that when a child is brought to you, when a baby is brought to you, at once the baby should have all these things. It is not like that. So you have to understand the baby first, and then only you can just ask some questions whether the parents are like seeing it, or even after half an hour or 40 minutes, many babies will not be able to interact with you. because they don't feel comfortable. When they go to a doctor, they feel like, and now in this COVID days, definitely we all will be wearing masks and shield and everything. So definitely the babies would be in fear seeing us. So first thing is we have to create an environment wherein the baby becomes comfortable, and then only we can assess that whether it is going to interact or whether it is going to have a eye contact, all these things. And between the age of 3 and 4, share toys and take turns. It will share its own toys, and some children will not be able to do that also. It all depends upon each and every children's personality. Begin engaging in pretend play. As I told, the role play or pretend play. Follow simple rules in games. And if you tell running race and all, you have to start here and end here. All these things, it would be followed. Sometimes become bossy and defiant. Definitely, this happens a lot, because when they see the parents more bossy and defiant, they also follow the same. And sometimes some children are also like that. Shows more independence, might show attachment to one friend. So it will have a Barbie doll or a bear doll or anybody like that, or even a specific brother, sister like that. She may show a attachment to only one person more. Between the age of 4 and 5, she develops friendships with other kids, compare themselves to other children and adults, understand other people's thoughts and feelings. Like if you're sad, if you're dull, the baby would, the child would come and ask like, what is it, Amma? Why are you dull? Why are you not okay? Why are you angry? Definitely the child would ask. Initiate or join and play with other children and make up games. So when it is going to be a female child, definitely she'll be interested in doing all the makeup stuff. Show an understanding of right and wrong. Listen while others are speaking. So the child will develop an habit to listen. We have to listen when we speak, because all these listen while others are speaking and all, you have to inculcate more in your children, as the parents as role models should follow it first, and then the child, by seeing the parents, definitely the child will also do the same. And development of social play, as I told you, the symbolic play and social play. Social play is with others. Symbolic play, the child can play on its own, and social play, it will play with others. Like the stages of development in this solitary play, in this play is, there is a separate field of psychology, that is play therapy. For less than 3 years, 4 years of kids and all, the assessment itself is play therapy. By introducing play therapy, the clinical psychologists make some assessments. Like the solitary play is children play alone with their own toys. They do not get close to or interact with other children. Solitary play should be encouraged because it builds skills for working independently. Why you have to encourage solitary play means it will how to be independent. So the major point is how the child plays. Many a times a child, if it is a single child, it will play on its own, but the habit of playing with others should also be inculcated. So it is done from birth to 2 years. Parallel plays, children continue to play on their own, but they are beside children and may be using the same toys. So this also includes the same only, not very big difference. But sometimes this also occurs from 2.5 to 3.5 years. Associative plays, children begin to truly play with others. They share play materials, but may be following their own storyline. So they share, but she might be playing in a different world and the other person will be doing a different thing. So this usually happens from 3 to 4.5 years. Cooperative play is highest level of social play, where children play in groups and everyone is cooperating to achieve a common goal. This type of play involves negotiation among children. This happens when children change roles in the play and or take turns making suggestions about the plot. This is about a game which you are playing, like throwing a ball or playing tennis, all these things. 4 to 5.5 years. Like you have different races, and you have different games like frog jump, VR walk, all these things can be played, and they have certain rules. Games with rules is the next thing. A part of, in cooperative play, the rules doesn't come, and games with rules, you have certain play, where winners are there, losers are there. It is a kind of sport activity where it is done after 6 years. Onlooker play, when a child watches other children playing but makes no attempt to join in. That is the onlooker play. That is a kind of play also where the baby or child is observing everything, but he or she will not join. But it will, he or she will do in a different environment where he or she is comfortable. So this is usually done from the birth itself. And developing a sense of self. Why play is important? Because play only encourages children to be self-independent, showing self-confidence as they develop, demonstrating persistence, a can-do attitude. That is, I can do, I should do. These all develops from playing only, showing greater self-direction, being better able to express or regulate emotions, enjoying playing alone or near the children, developing coping skills for change, adversity, managing anger, showing awareness of personal uniqueness, recognizing that they are members of groups, using pretend play to express feelings. So these are all some of these self-sense activities and independency to regulate their emotions, to express their emotions. All these things are done only through play. Development of sense of self over time. So how the sense of self develops? From infancy, there is no language-based statements, gradually comes to recognize self in mirror. So as I told you, from 7 months to 9 months, the baby will be able to recognize. And from early childhood, I am a boy, I like soccer. So even the elders would say that you are a boy, you are like this, because sometimes we may label things like that. So all these things should be avoided to have a gender inequality and gender discrimination, which is really important in a family where a girl and a boy are there in the same age. Concrete self-perception based on appearance and favorite activity. Some things like a boy should play cricket or a very rough game, something like that, because they themselves name it like that because they see the environment naming it. So that is why they have a concrete self-perception based on the appearance and favorite activity. Middle childhood. I watch my brother do it first, then I know I can do it. Social comparison becomes an important source of self-efficacy and self-concept. So the child sees others and then it does it. So it is a sign of self-efficacy and self-concept. Adolescence. I'm fairly shy with new people, but I'm pretty out there with my friends. So this is what an adolescent feels like. The adolescent would be able to tell what I need and what I don't need. So it is abstract psychological concepts of shyness and self-descriptive terms differentiates ability and efficacy in different social contexts. Like she might say that she's not going well with others, but she's good in her family, friends circle. So that is what an adolescent will say, that this is what I need and I am comfortable in this. So this differentiates ability and efficacy and in different social contexts. Assessment of social development. How to assess this social development? Because for each and every domain we are I have given how to assess. So stages of social development is first birth to 11 months, adult interaction. How the child interacts or the baby interacts, looks at the speaker's face, enjoys. These are all some signs. Enjoys physical and tactile stimulation, smiles reflexively, makes eye contact with speakers, is aware of people close by, wants to be picked up or held up by others, expresses like or dislike for things and situations, enjoys social play, explores adult facial features. So these are all some of the, as adult we can observe. Self-concept and social role. The response to adult attention by smiling and vocalizing, engages in frolic play. And peer interaction is when the baby sees the other babies doing it, it will also go and play, or it will touch the other one. Sometimes it will beat also. So these are all some of the peer interaction where you can see birth to 11 months. And from 12 to 23 months, it resists being put on back. Like when you do like this, sometimes the child will not stay. But during the younger age, from till 3 to 4 months, the child will stay like this. Okay. Shows like or dislike for certain people, recognizes self in mirror, displays independent behavior, that is enters the no stage. She will deny or he will deny, no, I don't want, like that. Exhibits tantrum behavior. Tantrum means doing all temper tantrums. Shows preference with toys. Imitates adult activities. Example, cooking and cleaning. So these are all some social development factors where you can assess easily. Next is from, and also expresses emotions, explores hands. It will make all hand movements and what hand gestures and all. It will like to make hand puppets and all. And 24 to 30 months, this engages in experiments with adult activities, shows appropriate affection towards family of people, pets and belongings, smiles and claps when praised. It shows awareness of feet. Feet in the sense like to play with the feet, making sounds and all. Enjoy solitary play for a few minutes. Defends possession by using gestures or saying mine. It will say this is my toy, or it will take a phone. She will take a phone and say this is my phone. Instead, when you say it is your phone, she will say no, this is my phone. Recognizes self as a separate person. She will say I want this, because that self develops. Responds to name, protests but submits anyway. Engages, protests but submits anyway, in the sense when a mother says no, you have to listen, then she will submit. So it is for some persons she will listen, many persons she will not listen. Engages in dramatic play, follows instructions related to activities, daily routines, transitions well, shows pride in accomplishments. So she will be really very happy when you encourage her. Notices other peers, plays with peers, uses gestures to engage with peers, plays next to other children, enjoys rough housing, shows sympathy for peers, copies play activities of other children. So these are all some of the common social developmental skills where the children develops from one stage to other stage. And even in 36 months, spontaneously greets familiar people, listens to a short story, assists with simple household chores like setting table, throwing away trash. See, in 36 months, if you encourage a child to do all these things, when you ask the child to do the household chores from that time onwards, the child would become more responsible. She will take care of her things very well, and even she can teach her younger ones very easily. Accepts adults' participation in activities. Responds to what is your name. This is a social role. Engages in pretend play. We to use the nouns I, me, or name. Correctly responds to how old are you. Begins to engage in adult role playing and limitation. Peer interaction would be like recognizes differences between familiar and unfamiliar children. Plays with peers without disturbing others' play. Variations in developmental patterns. So now we have seen, so far we have seen the normal development. Now we would see some variations. What are the variations in developmental patterns? So developmental progress is highly dependent on multiple factors: the general health for the child, the general physical health, opportunities for learning. Learning is like more like exploring. Temperamental characteristics, like this, the personality characteristics of each and every child. Willingness to try new experiences, that is the child, how it is allowed to explore. Genetic endowments, some factors, it depends upon the genetic makeup also. Coordination and strength and socio-economic factors. So all these things plays a major role in the deviant patterns. If delay occur in more than one domain, persist over time or both, they are considered significant. So if you find that there is a delay in one, like in social domain, there might be a delay, or in the cognitive development, there might be a delay. If there is a delay in one and more domain, then it is to be considered very important. Sometimes if parents raise developmental concerns, these concerns must be addressed freely and openly. As I said, many parents are more anxious nowadays. They want their child to become more intelligent, more like a champions, more like Avengers kind of children they want to develop. So they have to be like, the questions will be like that. So you have to manage them easily with your intelligence, of course. So for that, you have to work on all these aspects so that you can answer the parents very easily. Important development across all domains. So in all the domains, you have to see if there is some problem in the 2 domains, then you have to consider all rest domains also. Parents are rarely comforted by superficial evaluation and pat reassurance, and although prudent waiting may serve some families well, it may arouse anxiety and anger in others. As I told you already, see, if a parent is more anxious and if there is any problem, if you say, no, no, this is very simple, and definitely the parent is not going to accept. Because many a times for this mental health issues, parents are not satisfied with a single doctor. They go to all sorts of treatment, but they fail to follow a single stream of medicine, where they feel that whichever they feel they want to go, whichever they tell it is okay, they go and they shift over. So this shifting pattern, it is everywhere. So you have to understand the need of the parent also, and unnecessarily you cannot give any medicine to the children, or you cannot give false promises and all. You have to say this is this, and you have to follow like this. It would the outcome would be like this. It would be like this, but you cannot assure that 100% it would be like this. In any case, it is the same, right? So the thing is, you have to reassure. You have to give some confidence for the parents, and you have to educate the parents also. Sometimes the parents may turn, they will be anxious and they will also be angry with you. So you have to handle the situation wisely. So this is about today's class. I think if there are any questions, definitely I'm ready to answer. But pertaining to today's class, I think if you ask the questions, it would be really helpful for me.
Thank you so much, ma'am.
Thank you. Thank you for patient listening first.
Honorable Speaker, respected doctors, and all the participants of ayush and viewers, thank you all for being with us. Ma'am, shall we continue tomorrow?
Yeah, okay. There are no questions, huh? Only one question came. Okay. Okay, thank you all. Thank you all for patient listening. If you have questions, definitely you can ask me tomorrow also. So tomorrow's class would be about like the history taking, which is really a very interesting topic. So for the history taking, definitely you have to listen to the parents very patiently, and also to the children whom you can take assessments. Thank you all. Meet you all in tomorrow's session. Thank you, Dr. Devi Priya.
Thank you, ma'am. I, on behalf of ayush and on my own behalf, extend a very hearty thanks to Speaker of the Day, Dr. Hema Subhashini, ma'am. Ma'am will continue the session in tomorrow's class. Thank you, ma'am. Okay. I'm glad to announce another 3 more classes on 7th and 8th of August. A 2 days program by Dr. Pushkala, MS Ayurveda, HOD Department of Prasuti Tantra and Stiroga, SDM Institute of Ayurveda, on topic Sthanika Chikitsa on Stiroga in clinical practice, Uttaravasti, Pichu, Kalkadharana, Yoni Purana, Sthana Lepana at 7 p.m. From 9th to 12th August, Samhita Adhyayana, Ashtanga Hridaya Sutra, Ayush Kamiyam Adhyayam at 7 p.m. by Dr. Srinivas Vadiyar, MD, PhD, Ayurveda. And a 3 days class series by Dr. S. Rajbandi, MD, Ayurveda, Professor and HOD Department of Panchakarma, Government Ayurveda Medical College and Hospital, Nagarkoil, on topic Dhara Kalpana and its practical importance, from 9th to 11th August, evening 6 p.m. Medium English. Certificates will be provided to registered participants. Lifetime access to videos. Live platform for queries. Exclusive one-to-one discussion. Thank you so much. Meet you tomorrow. Thank you all.
Thank you.